harder can often lead to severe concussion amongst these athletes. A fellow teammate of mine, a female athlete at Pine Island High School, one day at practice jumped up to head the ball and ended up with a severe concussion. She was handicapped and restricted to bed rest for 3 months straight. She couldn't use electronics and couldn't do any physical activity. Although the doctors were able to diagnose her with a concussion relatively quickly due to her baseline testing at the beginning of the season, it was still a very hard time for her. We all know of someone or have personally experienced a concussion.
In our 4 main points, we will discuss what a concussion is, how to diagnose a concussion, the short and long-term effects, and also how to prevent a concussion. With the recent rise in concussions among today's athletes, this is becoming a growing concern.
First, we are going to discuss what a concussion is. A concussion is a medical condition when the brain hits the bones of the skull too hard. Officially, a concussion alters the way the brain functions. According to the webpage titled Concussions from Mayo Clinic, published on February 2nd, 2011, it says, a concussion occurs when the head is shaken so violently it alters the way the brain functions. It also states in that article, in order for a concussion to be classified, it has to have swelling and bruising. The female soccer player from Pine Island jumped up, headed the ball, her brain shook, hit the bones of her skull too hard. When she went to the doctor, they classified it as a concussion because of the bruising and swelling that took place. It took many months for her to recover from her accident.
There are many different ways that you can obtain a concussion. The first way is common from preteens to young adults such as ourselves. According to the article Concussions by Mayo Clinic, says that many young adults such as ourselves receive concussions by contact sports such as basketball, football, or soccer. This means that from a friendly neighborhood game of soccer to a state championship game in football are both possible risk factors of obtaining a concussion. The second way that you can obtain a concussion is most common in young adults such as ourselves and adults. In the same article, Concussions by Mayo Clinic, says that the most common way for adults and young adults to obtain a concussion is in automobile accidents. You don't even have to have your license in order to obtain a concussion by riding in a vehicle. You just have to be in the vehicle when the car is stopped, not needing to in a car crash. It doesn't even have to be a terrible accident where you completely total the car. Sometimes even little fender benders where you just hit your head just right on the dashboard is enough for you in order to get a concussion. And the third way that most people can obtain a concussion is less heard of, but is common in all age types. According to that same article, Concussions by Mayo Clinic, says that concussions can also be obtained by hard falls. It is just less heard of. So the next time that you're babysitting that little toddler running around the coffee table, goofing off, slips, falls, hits his head on the corner, we've all seen it happen. Or when your grandma wakes up in the middle of the night, being old and brittle, she falls, are both possible risk factors of obtaining a concussion.
In order for a head injury to actually be classified as a concussion, there has to be swelling and bruising in the brain. According to the page titled Concussion Overview from WebMD, published on July 23rd, 2010, it says that the swelling in your brain actually happens because of the bruising. It's just like when you get another bruise on your arm or anything, the actual impact causes the bruise and then it bumps over and that is the swelling. That same article goes on to say that the bruising is caused because there's blood rushing to the site of the injury so that it can start helping to heal the injured tissue. So when you get the bump on your arm, then it's because the blood is going there, and the same thing happens in your head when you get a concussion. The following video from Centers for Disease Control and Prevention titled What is a Concussion, found on YouTube on October 24th, 2013 is a great example of how a concussion occurs. You can see that there is a lot of space in between the head and the brain in this particular video. That's actually filled by fluid in your skull, but the brain it does when you obtain a concussion. It can happen anywhere on your brain, just no matter where it hits the skull. And the glowing is where the actual bruising and swelling will occur. So from that video, you could see that when you get a concussion, you're actually getting two bruises on your skull, or on your brain from your skull. And so you get swelling and bruising on both sides of your skull. And the doctors really need to pay attention to both of them, because if there gets to be too much swelling, and the swelling is actually touching your skull, it's just like when you have a bruise on your arm and you keep poking at it, it just gets worse and it doesn't have time to heal. The same thing will happen if the swelling in your brain keeps hitting the edge of your skull.
Now, let's talk about the different diagnoses you can take or have for a concussion. According to the article Concussions on the MedLife Plus website from the U.S. Department of Health and Human Services, posted on December 11th, 2013, it said that the first step on identifying a concussion is to know the different common noticeable symptoms, which include headaches and often dizziness. The same article continues to say that nausea and vomiting are also the other top two symptoms. Symptoms tend to be less noticeable and dramatic in adults rather than in children, but the symptoms are always the same.
Medical professionals have spent a great deal of time trying to diagnose concussions. In the article Concussion Treatments posted by the Sport Concussion Institute on April 13th, 2011, it says, a few ways medical professionals diagnose concussions are through neurologic exams and CT scans. Later in the article, it says the neurologic exams are paper and computerized tests, which will allow the doctors to find out your cognitive skills and abilities. For example, would be reaction time, memory, and problem solving. Also in the article, it talks about CT scans. CT scans are computerized tomography, which are recommended for people who have concussions when they have fallen more than 3 feet to hit the ground, adults over the age of 40, or people under the influence of drugs and alcohol at the time of the concussion.
Recovery for a concussion takes longer than most people would think, but it's also the most important step in ensuring that an individual does not re-injure him or herself. According to Medicine Net Institute, in the article titled What is a Concussion, published in 2013, doctors want their patients to have little to no brain function as possible during the recovery of the concussion, due to the fact that you're more likely to worsen your concussion if you are on electronics or things such as that. Also stated in the same article, a concussion usually takes about 7 to 10 days. In the article mentioned earlier called Concussion Treatment, it also stated that doctors want their patients to heal completely before returning to any physical activity or contact sports, due to the fact that you are more likely to sustain another concussion if you have had one previously.
Moreover, we know that there are multiple effects that concussions can have on the human brain. Getting a head injury can have both long-term effects, which are effects that last longer than 3 months, or short-term effects, which usually go away within the first couple of weeks after obtaining a concussion. According to the Mayo Clinic's page titled Concussions, the most common short-term effect is that you have short-term memory loss. Most of the time this is just that you don't remember when the accident happened or how you actually got a concussion. But sometimes you can forget little things like where you set your phone when you actually put it in the same place every day. But those usually go away within a couple of weeks of getting your concussion. That same article later goes on to say that many
more severe concussion as it goes on. Also, the second long-term effect I will discuss is MCIs, or mild cognitive impairments. According to that same article, says that concussions are also known to lead to MCIs, mild cognitive impairments, or neurological damage. MCIs are pretty much the first stage towards dementia or brain loss, memory loss. This means that with each concussion that you obtain, the more and more that MCIs and neurological damage can become a risk. And the third long-term effect that I will discuss is epilepsy. In that same article, Concussion Treatment says that concussions have been known to cause epilepsy, especially in young adults. So the more you play these contact sports and the more you put yourself at risk, the higher that these long-term effects can be reached after you have obtained multiple concussions.
Lastly, we will discuss how to prevent a concussion. Preventing concussions is a big topic among medical professionals today. Recently, equipment is being created to help reduce the risk of receiving a concussion. According to Michael Gray from Toronto Star in the article titled Soccer Concussions, published on November 25th, 2012, protective headgear is effective in reducing the peak force and the impact of a soccer ball.
On August 28, 2013, Robert Franks published the article, Helmets, Mouthguards, Is There Concussion-Proof Equipment for Fall Sports? Posted on the Sports Doc. It states, engineers are attempting to make helmets and shoulder pads for football players to be more concussion-proof. However, in the same article, it says there is no such thing as concussion-proof equipment. Athletes are hitting harder now because they feel more protected while they are playing. Coaches, parents, and athletes need to be educated on the lack of concussion-proof equipment.
Educating people on concussions is the best way to increase awareness and prevention. According to an article titled Matt Dunnigan is a Voice of Injury for Prevention for Concussion with Think First Canada, posted in the Canadian Newswire on April 28, 2012, he said that the best way to prevent concussions is to educate both parents and coaches of the sports on the harms and effects that they can have. The article continues to say that when the children reach about the age of 14, their head and bodies are in best proportion to each other, which makes it a lesser chance of them suffering from long-term effects of concussions.
Along with that, the article Preventing Sports Concussions Among Children by Robert C. Cantu, published on October 6, 2013, says that now that we know that the child's heads are becoming more proportional to the rest of their body by the time that they get to be 14 years old, they're changing the minimum age for many contact sports, such as tackle football, to 14. So up until that point, they would just be able to play flag football. They're doing this because by the time that they reach 14 and their head is in better proportion, not only is it in better proportion, but the neck muscles are also stronger, so they're less likely to obtain a concussion from their head getting jostled around more than it usually would if you were a toddler or a teen. That same article later goes on to say that they aren't just making a new age minimum for sports like that, they're also making rules against certain types of contacts. For example, in soccer, they're trying to get rid of heading the ball. So to do this, by doing this, you would take out some of the people that would be obtaining concussions from either heading the ball or going up to head the ball and actually colliding with another player.
There are many different views from physicians as to when an athlete should permanently retire from a contact sport after they have received concussions. The first opinion I will discuss is symptoms. According to an article, Concussions Overview by WebMD, says that athletes should permanently retire contact sports after they have only received just symptoms or mild impact. This says that after a football player takes a bad hit and suffers a headache after a few days, but it was not diagnosed with anything, According to that same article, Concussion Overview says that athletes should retire when they have received more than one concussion, went in to see a physician, or their symptoms prolong. This means that after they have received more than one concussion, or that their symptoms seem to not be going away as good as the first one, and they seem to be prolonging, taking longer to get better each time, that then they should then retire permanently from that sport in order to prevent any more severe concussions. And the last opinion I will discuss is negative effects off of your baseline tests. A baseline test is what an athlete takes in the preseason to determine where they are at, and then after they have received a bad hit or they take a bad ball to the head, they are asked to retake that test, and physicians and coaches will take note of any negative changes from that test from the beginning of the season to now. According to that same article, Concussion Overview says that
Can I have your attention,
they
please?
should
Keegan
permanently
Majere.
retire when they have received too many negative effects off of their baseline tests. This means that after they
Can I
have
have your
received
attention, please?
more than one
Keegan Majere.
concussion
Please
or
come
one
to the
severe
gate office.
concussion,
Keegan
and
Majere,
their
gate office. And a
baseline
reminder
tests do
about
not
the
match
K-8
to where
staff meeting
it
after
is
school today. Thank you.
effective to be playing that sport anymore, that they should permanently retire and no longer be involved with that sport or contact sports.
In conclusion, we discussed that a concussion is when the brain bounces back and forth between the head, causing bruising on both sides and swelling. Next, we discussed how doctors diagnose a concussion based off of the baseline test that the athlete takes at the beginning of the year,
Zach
and then how
Kennedy,
it,
please come to the high school office.
and then how
Zach
it
Kennedy, please come
relates
to the
to
high school
the
office.
changes
Thank you.
from the beginning. Next, we discussed the short and long-term effects, short-term being nausea, headaches, and short-term memory loss, and the long-term effects being if you suffer another concussion after the first one. And lastly, preventing a concussion due to the improvements in not only the sport, but also the equipment.
As my fellow teammate found out, after spending many months handicapped from a concussion, the effects and causes of them can be a risk to your health. Running fast